Okay, the first thing we will do before we start the meeting, and when the meeting has started, the first thing we will do is to have the roll call. The roll call, so Larry,
Thank you. All right, again. May we,
here.
Larry Finn, here. Eric Diaz,
Yes, you.
Nisha Fields. Naima Khan,
Here.
Ramya Rao. Anna Kakar,
Here.
Robin Oliveris,
Here.
and Johnny Rivera. So, Arnett Scott. Absent. Carmen Perez. Absent. Okay.
Okay, and just one more thing, that I sent out the minutes. With the last mailing, are there any changes or revisions to the minutes? If so, please speak up now, members. Okay, so the minutes are approved. Okay, so our next thing is we have a member of the public with us, on the Zoom, Will Fern. He is going to give an announcement or talk about. the issue.
Okay. Yeah, ready to go? Okay. Hi, my name is Bill Ferns. I'm a member of SALT, which is the Senior Advocacy Leadership Team, an all-volunteer group that works out of Manny-Cantor. We're all older adults. The reason I'm here is that SALT is asking CB3 to consider endorsing the New York Health Act, and we felt that this committee was the place to start. Briefly, the New York Health Act would enact a single-payer insurance system in New York State. It would guarantee comprehensive, high-quality health care for every New Yorker with no exceptions. Once implemented, the New York Health Act would ensure that every New Yorker receives primary care, special care, vision, dental, hearing, mental health, reproductive care, substance abuse, maternal care, prescription drugs, and long-term care. We feel it's particularly important this time because the federal government is cutting back Medicaid and Medicare, and knowing just how many people in the CB3 catchment area either rely on Medicare, those of us who are seniors rely on Medicaid, or a combination of both. It's really important that we push for this act. The New York Health Act was originally written by a retired Assembly member, Richard Gottfried. It has a lot of sponsors, including our local Assembly members, Grace Lee and Harvey Epstein, and Senator Brian Kavanaugh. According to the campaign, under the New York Health Act, there would be no more expensive health insurance premiums, co-pays, deductibles, or prescription costs. Now, there's a lot of issues about this, and I'm not asking people to discuss it now, and I will send information about it to Susan so she can disseminate it to the committee for future discussion. But I'm just bringing it up today so that you will consider putting it on the agenda for an important discussion and, like I said, endorsement. We're asking, we're working, it's a grassroots movement trying to get to all the community boards, various other groups to basically put pressure on the Assembly and the Senate to pass this, and the governor to pass this, again, in light of what the federal government's doing. I'm going to leave it at that. I know there's going to be a lot of questions. We're not going to try to deal with it in whatever time I have left it. I also want to tell you, I have to apologize. Susan let me speak early because I have to go to a meeting of the 7th Precinct Community Council, which got rescheduled for tonight. So thanks for your time. I hope you'll think about it. I'll also give Susan my email address so that you can, anyone could send me questions about it. We could probably even get Richard Gottfried to come and speak to you, to the community board about it, because he's very willing to come and do that. And to hear him speak about it is compelling. Thank you for your time. I'm sorry I went over time.
Okay, so Bill, before you go, it sounds like you want us to take a position to endorse it. And if that's what you want, we would need to vote on it. So as you know, there's a process. The committee has a meeting in November. We would have to have a speaker, the information, and we would need to have a resolution that would be voted on. And then after that, if it passes the committee, it would be voted by the full board at the end of November. And so the earliest, so if the, board endorses it, the earliest it would be the end of November.
I understand that. Could you tell me what the deadline for getting it into you for I'm sorry, the November meeting.
Would 2 weeks be okay?
Oh, yeah, I can get it. Yeah, yes,
Okay.
yes.
Can I also ask if you're working with Metro Healthcare for All, which is the oldest single payer?
I have to, there's so many groups involved, Susan, I have no idea. So I'll find out if it's them. I can send you a couple, in the information I can gather, maybe they're in there. I know, yeah,
I'm happy to connect you. The person who's the head actually lives in our district also.
oh, that'd be great.
And that's Mark Hanna, and they've been working with all the unions for many, many years on single payer.
Okay, great. Oh, one of my colleagues is right next to you, to your left, I think. Yeah. Okay, well,
Yes, I told them you already spoke.
again, I apologize for having to leave. Thank you for letting me speak quickly. Thank you.
Thanks, Bill. Thank you, sir.
Okay, so we'll be,
Yeah.
you'll be contacting us to put it on the agenda.
Okay, thank you.
Thanks, man.
So the next thing is, we're going to be voting, discussing and voting on district needs and budget priorities. District needs is first. So,
You want me to say a little bit about how it's changed this year?
yes, one, please.
Okay, so, thank you. I think I would know. Thank you. So the process for the budget priorities has changed a little bit this year in a very good way. I've mentioned a couple of times the network of the 59 district managers, and this is for 2 years. We've been working with city planning to make this process more community board user friendly. And in the past, we had to, each committee created one list. And in this committee, we used to like pit seniors against kids and that kind of thing. And then we would have to make one list for the whole board. So we never have to do that again. We will make a list for each agency and we will rank within each agency. So we're telling ACS what is more important at ACS. And so most of our agencies, it's only expense items, which are salaries and programs, that kind of thing. We do have some agencies like DOE where we also have capital requests. And we now have a third category we can use, and it's called continued support. And these are programs that are funded currently. We like to use our ranked priorities to bring money in that we don't have. So then there's other programs that are funded. And we want to express how important they are, so we can say continued support. So all that's is new this year and is quite a relief. And I have prepared, well, May and I have both done this, prepared a list that Larry's gonna put on where we took all of last year's priorities from this committee and I grouped them by agencies. So you can change the priorities, but you don't have to worry about grouping them. And then also, part of this process is there are group budget consultations with agencies. Manhattan has 3 days of consultations where each agency will come in for like an hour and a half. We've prepared agendas in advance. And the committee chairs and district managers go, the minutes from all of these with all the agendas and all the answers are on our website under resources. And so there's a few new things or things that are just, the explanations might be changed a little bit based on what we learned from the agencies this year. And that's all I have to say unless there's any questions.
Yeah. Yep, okay. If you received it by email, you can also look at your email. And so should we go through it item by item?
Yeah,
Okay.
Larry's gonna share a screen. Do you want to go through them? Do you want me to go through them? How do you want to do it?
Should we read them or? What?
Well, we have to read the heading for each one. I don't know if you want to go through the, all the explanations. It's up to you.
Okay.
Most of the explanations, most of them are the same as last year.
Okay, so the first heading is increasing funding for more outreach consortium, homeless outreach workers and supervisors, so that. So the explanation is the same, and then you see how the agency responded.
Yes.
And then under that it says CB, so for each one side that CB is. Can you explain what CB is?
That was
what do you
me.
mean?
CB is community board, and those were my comments.
Yeah, so we can look at it, everyone look at it and see if, you know, so we're not prioritizing right now, we're just looking at it and, you know, see if we have anything to add or any questions. So we're now talking about number one. Any questions about number one? Does that mean we can go to number two?
Yeah.
So number two is also DHS, but it is increased funding for more safe haven and stabilization beds. So we have, you know, our explanation and their response. And our response as well.
I'm sorry, I didn't finish it. I meant to say, they have not yet occurred.
They're saying the promise has not materialized, right?
Right.
Any questions for number two? So we're on to number three. So there were two that are for DHS, so the next one is for ACS, and that next two are for ACS and they relate to children. So first is a Promise New York City, Promise NYC, which is the child care assistance vouchers. And there is funding for this coming year, but it's not baseline. And your providers have told us, you know, it would be good if it could be baseline, because it's, you know, there's a real need for it every year.
Just a reminder, clarification, this distributes for 27.
Um,
But clarification, this is distributes for FY 27, because we're currently FY 27.
This is for, sorry, this is for, this is for the year starting, next July, so next July 1st. But I would suggest for the promise, you know, that we keep it in there and ask to have a baseline.
Any other questions, number three? Okay, so number four is also ACS and it's a Fair Futures program, ACS.
So if you'll notice the response, this is one of the very few times I've ever seen an agency say, thank you for supporting this.
Yeah. You might.
I will on to the next one. Yeah, okay, so it's runaway homeless youth. Okay, so now we're in the DYCD, so this is runaway homeless youth. And, we're just saying we want additional funding.
This is when the agency also informally in the conversation told us it could use support.
Okay, so number 6 is, the next one is the DYCD, cornerstone programs. Could you explain what that agency response means? Does it mean something other than what it says?
So there was a every year there's a number of responses that say contact the agency, which we never do, but we should. So they want to talk to us about it. So I would suggest that, you know, when we get our answers that that we decide which ones to pursue and follow up on. You know, and maybe just that one explains that the RFP system, sometimes I like to pretend that because it's an RFP system, you don't need expanded or increased funding in order to be able to issue RFPs. So, I mean, there's nothing we can do about it now. This last year, they said, contact us. We didn't do it. We can, I would suggest look at the answers. We've also been working with the agencies to get better answers. And I'm hoping that next year we will see improved responses. So I think we just should plan to pay more attention.
Unrelated, the lights just go off automatically. The lights, they go off automatically.
In the office.
Just wanna make sure.
Oh, yeah, it's the sensors. It's on
Oh,
sensors.
yeah, I didn't know.
It's a new law.
Okay.
Okay, so the next one is,
Increase funding.
oh, okay, please. Oh, it's look like it's Sonic and Comp. The Sonic and Comp residents after school programs for elementary and high school.
So what the agency did was totally avoid an answer. But we know from our CEC particularly that this is one of the most important things in our community.
At least we saw the announcement, they increased funding that this fiscal year, so that's good. Calm.
Okay, so for number 18, it's an increase of, it's for SYEP, which is also a DYCD program. So that's employment for, yeah. Pages, I think 14 to 21 or 25, oh, 24. 24.
Yeah.
Okay, so the next one is also, it's also a DYCD program and it's called Rough Learn Grow. And it's a continuation of the SYEP experience for the kids. So do they have the same response? Any questions about those two?
So I think I'm missing something. Sorry, I'm just a little confused. Why would the agency responsible to contact the agencies? Also,
Because they want to have a more, either explain it or have a more detailed explanation. It's not a very good response.
yeah, it's pretty good.
Yeah, so Susan, again, she was saying the opportunity to contact them will be like next year when they gave us the response. We really did contact them and, I mean, we can't contact, we may not want to contact all of them, but we can see which ones we want to contact and maybe, you know, set up a meeting or a talk with them. That's what they're saying.
Susan sent her.
What? Yeah, this is one that May added.
Yeah, but was she,
That's the one you sent me to add.
oh no,
You're looking at the old one probably.
oh, this is. Oh, this one, okay.
Mhm.
Okay, so we did SYEP and Work, Learn, Grow. The next one, it's highlighted in yellow, so it's a new, well, it's not for them, it's probably not a new program, but it was not in our list of asks for before. So I got this from the DYCD budget meetings, and they actually say they have a program called Services for Immigrant Families, and includes legal services for youth, as well as some comprehensive services for families, immigrant families. So we want, say we want, that's important for our community. And we want to see funding there. Any questions? Okay, so now so that's all of DYCD. The next one is the next two are related to the Department of Education. The first one is the Bridging the Gap program. And they have the same response, contact us promptly for more information. Okay, then the next one is related to the school nurses.
Okay, that, we had that one last year, but I changed the explanation based on new information that comes.
No question about those two?
I just like to say that I like how Susan added, being able to offer school nurses competitive salaries. I feel like we should be more specific in the other statements of what it is that we would be increasing the funding for. I really like that last statement is to like increase the salaries of the workers to provide, services for the students who need them.
No, this is, it's increased funding for the program.
And that goes directly to the employees who work for them.
Well, some programs, it depends on the program. Some programs, the agencies were very specific that they can't recruit or retain staff because their salaries aren't competitive. And that's more true in some areas than in other areas. In this case, that is one of the big issues, is having enough nurses. It's not that the program doesn't have the tools the nurses need, it's that they don't have the nurses.
Okay, thanks. So the next one was, originally we had a funding ask that was for the North. But we were told that it wasn't specific enough, the North itself is not like a program. It is a thing, but it's not so what they wanted to know is what kind of programs would fund the North. So what programs are needed to fund the North? When I say programs, I mean, I was gonna call it funding line. That we
Yeah,
call it,
it's
the
a
things that we
budget
need in the
line.
line. They always call it funding lines. So it's been deleted, you see, but it's put in.
I only deleted it because it's repeated further down.
Yeah, it's repeated further. Which is what you said. So it's repeated further down as its own ask from DIFTA.
See that real quick? Go back, just to see where it's repeated further down.
Well, we'll get to it. We're on our way there.
It's one of those, what you call it,
We'll get to it.
back into the shop.
It's on the next page.
It is in the phone. Okay. Oh, 12, okay. Okay, so we're still on this, the next one is about senior male education staff. So that's interesting. So this is the case of continued support.
That's what I suggested since they are saying that they're, they're having enough funding, but we certainly don't want to lose it then.
Okay, so this is, Eric, this is what's further down, number 15. Increase funding for home health care services.
Remind me that this is DIFTA, advisements saying that the north is not too broad, but this is something you like.
Oh, no, we had a meeting with OMB, was it, remember when they were,
Well, OMB, called the meeting, created all the meetings, organized all the meetings. So OMB was there, but the agencies were there.
no, I'm sorry, it wasn't OMB, earlier in the year, there was a meeting, was it?
Oh, that was city planning. So what happened on that is city planning, because we're working with them to try and improve the process. City planning had a walkthrough of responses with us, so, it was me and I got quite a few chairs, all the committee chairs I could get. And so they walked through this information and explained to us at that time how you had to be very specific for the programs in order to get funding.
Yeah, so they actually pointed this out as an example, about how our explanation about the funding for the North wasn't very specific. So we kind of like got a non-answer, as something like, we don't fund this, so we don't know what you're talking about, that's basically what they said. But we're trying to improve that by making it more specific.
I see. Cause I will tell you, and I know Carmen Perez would probably agree, over one North Florida, it's probably a social worker line. Is something.
We've emailed her several times, to get
Something.
and trying to get her to give us specific programs.
That's right, because at the end of the Ryan meeting, that was what we were at Ryan meeting, talking about how she was gonna get back. Well, shoot. So, yeah, no, I would say social working would be a line for me.
That, what program is that?
No,
No, what's the So, are you saying there's not enough social workers? How, but we didn't have, so that's why every June I say you need to put in all your questions so that we can research them. We don't know what the issue is. We don't know that there's enough social workers. We're not aware of any documentation that there isn't. We haven't had an opportunity to discuss this with the agencies. I mean, we can't just sort of make up stuff we don't know now.
I would say some operating work and Carmen Perez would back that up as well.
Like I said, we've emailed her several times.
Still, I want you to hear me as well, so that on the state level, the North, get funded for nursing specifically, as to the point of expense on.
But we're only talking about city budget.
What I'm saying is that they help in that, and so that's why the nurse expense line wouldn't be a priority in the health program from the city level or from the fire capacity. But social worker line does not get funded from the state, therefore social worker line is something that's, definitely demand. Also for the same reason as pay parity.
Can you back up a second? Did you say social workers are not funded by the city?
No, I'm saying they're not funded by the state, there's not allocated more social workers funded from the state. But from the state, there is for a North nurse line, therefore, the social worker would have that from the state, it would become the next pivotal job opportunity that needs to be secured and advocated for, at least at a city advisory level, because of the pay parity not being able to be competitive to keep a social worker. We'll lose them to the Department of Education because we just have better benefits and that sort of thing. So I come from that perspective, firsthand experience, understanding that budget line. And I'm sure Concord will be, I'm sorry, to continue on that, but that's something I would say as advocacy to keep it North as something that's a priority to be funded, but specifically so to look at on. And I'm not pulling that on, forgive me for crude language, but that's something that's just firsthand, and not pulling from the air.
Well, if the committee decided to vote on it, it would still be good before the full board to get some kind of documentation.
Sure. Will you vote on it? Will the board be?
So what agency does the social worker salary come from?
which is what we're talking about,
Does the funding line have a name?
social,
Just
Or
social worker?
yeah, more social,
Or is a okay,
correct.
so,
It would be really, I think it would be really helpful since Carmen works with that agency, if she could give us some direct information.
Correct. I also work with that agency, so on contract with them, just in English queries, and we could get that also.
Okay, yeah, if someone could give us some direct,
Yep.
is funding gone up, because most of where we're asking for pay parity, most of them have gotten increases, and we're saying the increases are not enough. So, have they gotten COLAs, have they gotten increases, is it still difficult, specifically to recruit and retrain, because what we've been doing is using their language. So if you could get all that information, like within the next week, so that we could have it all put together before the full board.
So, we go ahead and, thank you, Evan.
Okay, thank you. So it sounds to me like what you're doing is going back to the one that we took out because we said it was a duplicate and we're now gonna make it City Norks, and put in, text about social workers. That's good. The next two are ones I added from the consultations.
explain.
You want me to explain?
Yeah.
Sure, so these are from, as, Department of Homeless Services and Human Resources now together as part of Department of Social Services. And the HRA division part, has a funding line for city FEPS, which I'm sure you've heard about. That's the vouchers that people in shelters get, particularly, as rent supplements, so that they can afford, to rent an apartment, have help in renting an apartment. And there's always not enough money and not enough vouchers and, so we put that in to increase the accessibility of, housing for people. And then the other one, sorry, I skipped one. And the other one from HRA, which didn't have it last year, but we've had it in the past. And that's for legal service and eviction prevention. And that is another area where we're specifically talking about, we can't get lawyers because we can't compete. It's impossible. If we do recruit them, we keep them for 1 year, because then they all go for a higher pay. So that's, those are two brand new HRA ones. And then we have one more new one, which is the Department of Mental Health, Department of Health and Mental Hygiene. And that's funding for inspectors. They do not have anywhere near inspectors for any of their programs, but they specifically mentioned the pest control, which are rats, the restaurant inspection. And then they also respond to construction dust inspections, which is a huge help this year.
A question, my HRA, they didn't ask for another type of program funding increase. They have a program that helps people that are not currently employed and to place them in internships. I'm surprised they didn't bring that up as something that they would like to have.
So they bring up everything that the community boards put on the agenda. So every June, you must be sick of hearing me say this. Every June, when I say, what do you want on the agenda? That's when you do it. But
Yeah.
we create the agendas. The agencies don't create the agendas.
Yeah, so this is all these are from the community boards, the agencies respond.
Yeah.
So when we say they, we mean us.
Yeah, and it's the 12 agencies. We collect questions from the 12 Manhattan agencies and submit it as one agenda.
Okay, so now we're on,
Now we're going to capital.
okay, so why is there in the school about access crossing, why is there something about an elevator on illustration?
Where's that?
You know, they're for the party edition.
Is that the stuff that's crossed out?
No, I think this just got me involved. This is another bullet. point.
Oh, that's because,
The last
the
sentence.
reserve.
Yeah, that's the.
It's at the end of the count.
You know what, that's, it was actually was the next item,
Yeah.
just pushed in, just cross it out. That was from last year, that was one of the CDC priorities from last year.
Okay, so now we're on to our capital expenses, and number one is the school at Essex Crossing.
Okay, the next ones you see all crossed out, those were the priorities we got from CEC last year. So they're all crossed out, and below that, you will see all the new priorities we got from CEC District One this year. And that's it, folks.
So now we rank it by agency, right? First.
Right, you can go into each agency and see if you want to change any of the rankings.
Okay, so we're gonna go back up to the top. And the first agency, and actually, the agencies are not ranked against each other, right?
They're not at all.
They're like separate columns.
Each one is a separate, totally separate.
Okay, so currently there are two DHS, funding priorities, expense priorities. The first one is for the outreach workers, and the second one is for the safe haven. So last year we said outreach workers were number one priority, safe havens were number two. Do we want to keep it that way or not?
Sense of-
Okay, so it looks like we are. And next one, it's ACS, and there are only two that we have to compare to each other. The first one is the Promise Program, the second one is the Fair Features Program.
I would, just propose to maybe swap it, personal preference, no right or wrong, I say, I would say, good, because it was on the second. I, look to help that age group we possibly can. That's it. Okay, we'll vote. That's it. And
You guys can vote on it?
yeah.
I agree.
Agree, all three, okay, enjoy, all right, you got it, all right,
Yes, I'll stop.
done. Thanks.
It's just copy and paste. Numbering, it's not gonna make any sense, but
Well,
we'll be done early. Yeah, yeah.
it's checking.
Okay, yeah. Okay, that's ACS.
Okay, now there are many DYCD programs, so it's a little bit more complicated. There are 5 DYCD programs. No, 6 DYCD programs. So we have to run to 6.
I would personally say number 7 to be the first one, is number 1 out of the 6, which is the compass and sonic program. I think the name is just simply, I've seen the cornerstone program, they're awesome, that's just.
Speak into the mic.
Yeah, sure, so that's all, also healthy, but, compass program is sound, so our age group can definitely be it, because it goes as well as kindergarten, to 8th grade, so I think that's something. important priority.
Can I make a comment on that?
Sure.
The after-school programs are incredibly important, but they do have existing funding that we would like more, but it's adequate. The runaway and the youth, they're actually asking for more. They're saying that they need more money to provide necessary services. So it's not a question of one being more important than the other, it's one needing more money than the other.
As per the UICD, correct?
No, it's not.
Pardon?
Where is the information at? Is it from the providers or the YCD?
This is under, it's UID's, the agency is saying they're dependent on the availability of additional funds for the runaway youth. So that's what I'm going by. In order for them to continue providing necessary services, they need more money.
So the,
I said the bottom is one of the right, 75, one of those. Small.
okay, so I understand. So the YCD is saying that, they need more money for runaway homeless youth. They need to advocate for it more. So in terms of citywide, they need more money for it. And they have enough money for it. So it's a question of not what we like, but what is more important, or what is, but it's more like where they need to fill a hole.
And I would like to just add, it is so unusual. The agencies are told. I guess I'm saying this in public, but I'll say it anyway. The agencies are told to say everything's wonderful, everything's fine. We've all confirmed that. So for an agency to say we don't have enough money to do our job, they must really need money.
No, absolutely. And to the point that it is a citywide request, correct? I'm focused when I say more important or something like that, I'm speaking more important to Stephen for me.
It's not a question of more important, it's a question of who needs the money more. The programs are both, say, equally important. One has money to do their job, one doesn't have money to do their job. That's what I'm focusing on.
So sadly, that's what we're boiled down to.
So, I would still keep my position, but thank you for kindly speaking and I understand it fully. But, so where's the runway? Is that currently number one?
I'm sorry, could you speak up more?
Yeah, no, I was asking the runaway, that's currently number one in UIC as a right now, as a priority. Where's
Yeah.
number one at?
That's what I'm actually suggesting, because like I say, it's so unusual for an agency to say we can't provide the services that we need to provide.
So, yeah, no, my question is, okay, over there,
Sorry, yeah, sure.
right, so that's what it's currently, that's.
Yeah, so one of those budget meetings that is always asked of every agency is, you know, like. It's like, you know, it's like, what do you think the community board should advocate for? And it's not just each community board for themselves, but it's like, you know, where do they need money to adequately fund something? So in this case, they said runway homeless.
And it isn't really citywide. This was in Manhattan. And in Manhattan, we're one of the 4 sports.
And so in terms of vulnerability, though, I would say runaway homeless youth are. They're the most vulnerable.
I agree.
There's number one. I would think before it's not a huge confidence, speed number two at Cornerstone.
Which one?
The Sonic and Compass, I don't know. It's because again, the age group that he captures. In expressing. Jackson?
I did that.
Thank you.
Oh, so one of the other things I would, this thing about the services for immigrant families. It does include legal services as well, and I think it needs to be moved up. Yes, all people are talking about these days, especially legal services.
I would actually look at number 2.
I propose to put a comprehensive time agreement too. I had someone read that, so could we start there first and then you can move to May's suggestion?
It looks like it's already number 2. We have runaway and homeless youth program first, and then for DYCD, and then we increase funding to expand access to after school program.
I think that's what's written on the one we have emailed to us, but not the one that's on the screen.
Okay.
As
Got it.
Propose to put that in two for now.
Yeah, I mean, it seems just to me like immigrant families are about as vulnerable as you can get these days. Okay.
Yeah, they would need extra services, translation services,
I'm just agreeing, I'm just saying that I put that on first, so have someone second, so we, let's move there, and then from after that, split there, in case of the baby. Exchange, they said that was talk about this in families. So now we can slot that in families where we think they should go. Right, yeah.
Yeah, so I think the immigrant families should be slotted in after runaway homeless youth. It's just a really, right now, it's really, vulnerable group. I mean, yesterday I went to the upstander training, and there was about upstanders, but nobody wanted to talk about the upstanders, they just wanted to talk about us. I mean, they had to be dragged back into the upstander agenda, which is fine, because they need to know, but it's just it's what they really need for this year. So I would like to see it go under homeless youth. I mean, I bet those services are not exactly new, I'm sure they're not exactly new, but they're being, packaged together.
So, sorry to ask you to put yourself, but where did you want this?
Right under runaway homeless youth. So runaway homeless youth is number 1, the immigrant services is number 2. Because they're the 2 most vulnerable groups. Right.
Yeah, and in our district, didn't we agree that most of the children who will need services are part of the immigrant demographic?
It's not just the immigrant demographic, but it's the specialized legal services for immigrant youth and the services for newcomers who they need counseling or referrals, referrals to service specifically for new immigrants. It's not just the demographic, but it's programs that are geared for them.
So one of the other things that,
And there's not enough, like I've heard, like one settlement house that they have at least immigration lawyer sort of part-time who doesn't really represent people, but just does workshops. And I said, where you get your funding? Because we're pulling together our flexible funding, which is like their, private donation money. But they don't have any government money.
so another thing we were considering when, on the list of who needs money. The first question of every agency was, what are the impacts going to be to these programs from federal cuts? So some of the programs are going to suffer a lot more from federal cuts than other programs. Because some programs are more dependent on taxpayer funding as opposed to federal funding. So that's another thing that we had to consider is where's your money coming from?
Yeah, there's no doubt that they're all equally as important. It should be, based on who would need more. Hopefully they all have the same amount of attention, but I feel like the immigration sector will definitely suffer more if they're already only pulling money from whatever they can find, and they're only putting money from scrap.
There's more funding needed in that program in order for them to do their job. That's the issue. They don't have adequate funding to do their job.
Area two, maybe. New Orleans has two. The third one, hopefully. If you, so that happens, you can move it up to number two. If not, both another, I'm okay with moving to number three, but.
Eric, can you speak louder? We can't hear you. I can hear you.
Well, I probably agree with Eric on moving it to number 3. I personally feel a little bit more comfortable with that. I just because number 2 also feels so high need, but
I'm sorry, what, can you say what is 2 and what is 3?
With Compass and Sonic, and then the immigrant. Which is what you're asking for, is being number 2. So what is 2 votes for making it number 2, it doesn't have any jumping 3 yet. So.
I'm sorry, I'm not understanding you. Okay, so just put out your suggestion. Okay, we're not voting on anything yet.
I would say the services of immigrant family program, get that number 3. It's the top 3 list.
and I think I agree with that, especially because number 2 right now with the Compass and Sonic is partly addressing a lot of immigrant families as well. So to me that to me it makes sense to keep that at number 2 as well.
Compost is just night shift, right?
No, that's the point.
I'm sorry. Oh, that's part of, never mind, I'm sorry.
Ooh, that's one, 2 people saying they're third. So
Yeah,
that-
I agree, I agree.
Oh. Sure.
Okay, so what you're saying is, okay, let me summarize because, because there's a lot of people talking and I can't hear all of you. So you're saying runaway homeless youth is 1, plus, Compass Sonic is 2, and then the immigrant the immigrant program is 3. That's what you're saying, so you're suggesting to move Sonic and Compass up to 2, but and keep immigrant, and put immigrant services at 3.
Correct.
Okay, so then there's 4 and 5. I wanna see the whole order first, it's very hard when you do this one by one. So what's 4 and 5?
Can I ask a question?
Yes.
Robin, for the after-school programs, are there any kids that are not getting an after-school program that are being cut out?
Right now, I think the children's workshop doesn't have after school and the neighborhood school, but, the thing is that, we have a lot of cuts. So due to the cuts, the principals can't pay the partial amount and the parents can't pay the other partial amount because it's so much. So they just don't have after school right now, but I know that, I think it's this week or next week, or this week came out already. The application for the fundings for after school. So I know that Henry Street University, I know that they're all applying for it. Last year, none of us got it.
So you're saying there are kids at this moment
That lost after
that
school from last year.
don't have after-school from there?
Yeah, I can get to a better list inside it.
Oh, that's not.
Yeah.
Concerned about seniors and seniors, cuts with Medicaid and Medicare.
Okay, so let's get back to, before we get to, Robin, before we get to seniors, let's finish with the youth. Okay, so there's 2 more, it's SYEP and Work, Learn, Grow.
SYP number 4, work, learn, grow, number 5, and cornerstone number 6.
So I think for SYP, okay, there is nobody that's being refused. There are actually people offered stuff. So it's always great to have more money, but they would probably be, if anything, under continued
But to
support.
be honest, this year FYP had
so many kids that I had to take 30 extra just so that kids can work because there were so many kids on it and there was no jobs available. Like every agency was overbooked. So I think it's going to be working, but they need more jobs and more
That's right.
stability. So I think they had enough money to pay all these
Yes.
kids, but I didn't have enough, like I literally took 30 and I was sharing them with Hampshire University Settlement just to get those kids, and if I would know, get those kids to do something and work just so that they can make their money. So I think that
So you're saying there's not enough employers?
there's
Yeah.
not enough.
Money is not an issue,
Money
is
is
what
not-
they're saying.
Yeah.
So I would put that into continued, a third category, which is continued support.
Yeah.
And if you want to help them, you have to help get more jobs for
Let
them.
it work sense, yeah.
More
So,
work site.
I would not flip them, I would put it under continued support.
Yes.
Okay, so to clarify, continued support,
It's a third
it's,
category.
okay, it's not in the prioritizing category.
Well,
The categories be prioritized.
it would, if you have more than one item there, you would have to prioritize it. But yeah, but you're right, it doesn't really matter, because you're just saying this is very important to us, we want to keep the money.
Yeah, we're gonna continue getting the funding because it is working, but it's.
Right. So Eric, I'm just gonna say, it's not, it's really not about what's more important. It's about what is able to function and serve. And what doesn't have the funding to function and serve.
Understand.
And more money is not gonna help us get more jobs for SYEP, what we need is jobs. Yeah, so money's not the issue.
Yeah, I would propose, based on these comments, to have the SYRP probably number 6. But keep working on grow, put it up to number 4, and then cornerstone number 5.
Well, no, work, learn, grow is it's for people who've done SYEP, right?
Correct.
Yeah, so,
Having
Well-
Cornerstone could help NYCHA support young people and get them access and information to getting SYEP jobs if we prioritize that. I'm not, is Cornerstone?
No, because those are totally, Cornerstone is a different, that's a different program. So SYEP. All the kids that want jobs have them.
So SYEP, kids from NYCHA get picked first, so those kids are automatically picked. What does that mean in my community? That is in my community where I live, none of our kids get picked. So for the past 3 years, none of my kids in my community got picked because all the NYCHA kids got picked first and they have first dibs. So that means that all those kids working, but there was not enough location for the kids to
Yeah,
go.
so it's not about
So it's
money.
not about money, it's about locations and having space to where.
So that's why I'm saying, I think. The SYUP should go under continued support, not be number 6, be continue, we're saying it's really important. But it's not a funding issue at all. And then the work learned follows that, because we have to have SYUP before you can go into that, right? I mean, it's the way of looking at it is just, it's really not about what, what's most important or in the community, it's about. It's strictly, we're looking at money, and money isn't always the only issue.
okay, so that leaves us with compass, right?
Right.
So then what is, so the current,
Well-
this thing is, runway, then compass, then immigrant families, then cornerstone, and SRP work on.
No. It's compass and Sunnybrook. I'm sorry about that.
Right.
It says cornerstone. So what's left is cornerstone.
SYEP's not being ranked, it's going in a separate category of continued support.
Oh, so it's not gonna be the,
No, it's gonna be continued.
okay, so then just cornerstone and then work on. Correct?
No, work, learn, grow is also continued support.
That follows, those are the SYEP kids
Oh,
year round.
okay, I'm saying, it doesn't say it. Which the continued support isn't listed. It is, okay, fine. Those two are in separate categories of continued support. Okay, so then we end it with cornerstone, right? That's what we're saying? And we move on to the next agency? or no?
Not yet.
Cornerstone wasn't very specific. I wish they had listed exactly what it is they needed funding for, but it seems.
It's just a huge, I mean, they do so many things, it's serve families year round.
Yeah.
You know, when we used to, you know, when Angel used to be on this committee, I mean, he said, I mean, 1 year, he said Cornerstone is really important because it's like everything in the community, so. And they always need funding. So, yeah, and we already have the fourth. I mean, right now, the way we're ranking.
Yeah,
So we're gonna just leave it like that. I mean,
Yeah.
It should not be taken off, is what I'm saying,
yeah, since they need funding, they should definitely.
but
have that.
it can be informed.
Okay.
That's it, BBC.
Okay, now we're done. Is any additional questions with the YCB? Okay. Okay, so the schools, DOE has two things. Right now it is, the first one is bridging the gap, which is for social workers and support staff for the homeless population. And the second thing is for school nurses. So that's 1 and 2. Shall we leave it like that or do? Or? So bridging the gap is for homeless students.
I
Students
agree.
experiencing homeless, and our cities, you know.
I agree.
Yeah, I think.
That's a consensus. Onward.
Right, now we're on to fifth stuff,
Right on tonight.
which has 3 things. Those 2 things.
Start, yeah.
They show us the funding for the meals and the kitchen staff at the senior centers. And the other thing was, that we had added was the homeless healthcare services, so that's.
And then there's meals too, there's 3 things. You have, so you change the one where we need the specific program, we change that into social workers. Then you have senior meals, and then you have home healthcare.
Alright. You see the social workers?
We changed that in the discussion, where we said we need to have a specific program, and Eric said, put social workers.
For the funding more, yes.
So this that we were deleting because it was duplicate, that's where Eric said to put social workers.
So, Carmen, just for you guys, if they have recommended, now, if we're gonna include the North Initiative for funding,
Right.
what specifically from the North? I had suggested that I was kind of speaking a little bit from the an assumption that we probably agree with it, but if all the expense lines within the North program, what would be kind of a high priority? I propose, I think, social work line is probably the highest, just to be competitive. with-
Right, because we're not necessarily like any regular senior center.
Right.
So the big thing is the. I agree with the having additional social workers on hand.
Mhm.
And also to continue the nursing program. That's
Correct.
been a wonderful thing that we've added and
Okay.
quite frankly, I would hate to see that go anywhere or reduced. Right now, what they've done was reduce the hours of the nursing program and I like to see that restored.
Carmen, did you get my emails I kept sending you about these things?
No, they're all here.
No, the emails where I kept asking you about the program, about the district program.
Okay, no, I mean, I brought them the emails.
Oh, okay, I needed the answers beforehand.
Oh,
That's
sorry,
what I
but
was-
yeah, I have them.
So now we're adding a 3rd thing, right? So to get more information about it, nurses' hours have been cut because there's lack of funding for nurses.
Absolutely.
So then we should be specifically saying that, as far as the, North, so that should be a separate North one. And it should be for nurses, and it should say that, lack of increased funding is needed because lack of funding has, you can use better words, caused, nurses' hours to be cut in the North.
Absolutely.
And we need restoration of full-time nurses.
Yes,
Now.
they're all part-time, as far as I know.
Carmen, let's see.
So I asked this thing about this. That's why I sent you the email about two, you know, I wasn't sure this was the right thing.
Uh-huh.
So there was a thing, that DIFTA has a funding line called home health care services. Is that nurses or is that something else?
Actually, that is something else.
Okay,
So.
So that depending on the senior and what their specific needs are, it may be more than just a nurse. You know, because it could also be home health aid, it could also be because in terms of looking at comprehensive housing of services at the home is to prevent them going into a nursing home. So everything that they would get there, they would get at home. And that's also, now they're trying to add, services for looking at cognitive dissonance. Since many seniors fall into either dementia or, Alzheimer's.
But this is still all home health care.
Yes.
So that's another.
home health care, but nurses is another line.
So
No,
that's-
nursing is a separate line.
Yeah.
Because nursing goes for everybody.
So we have.
So the
three-
nurses that we have in the office take care of everyone in the NORC.
So we have 3 lines for NORCs. We have one for home health care, or you don't even have to put NORC in. Home health care is one,
Yeah.
then you have NORCs nurses, and then you have NORCs.
Social workers, yes.
So we're set.
Senior meals, and
Yeah, North seems very comprehensive with respect to the amount of care that they provide to the elderly. And it should remain, it's at the top right now, right?
Yes.
Yes.
Yeah, I think that should remain there. All nurses are important, but it's beautiful that they are taking care of the elderly in their homes.
But the North is a structure, but there's 3 different programs that we need to ask for.
Distinct within the NORC. She's right. Mhm.
Oh, okay.
Okay. The North itself is not a program.
well.
Got it, thank you.
Which is-
That's
That's why,
But it's
So
not,
that's-
that's fine.
It's not a funding line, it's not an expense.
that's why we were told by city planning
Uh-huh.
that we should not, that's what the email was about.
Oh,
That that's not adequate, to say that. You have to give, yes, they need, and it wasn't just this, I mean, this happened in land use and other stuff too. You have to give very specific budget lines.
I see.
That's why I was trying to get you to answer me so we could research and
Uh-huh.
have everything researched before. we-
Apologies, that I just put that in.
It doesn't help at that point.
So when
Okay,
we're not specific, they give us non-answers.
I see.
And you know,
They should be more helpful, but they're not. You
No,
know,
obviously
so
not.
Tell me stuff from
At the end of the
someone
day,
else.
they really don't want to give out the funding. But, we have to fight back.
well, I would like to say that I think city planning actually was very helpful in going through. They went through every priority we
Yes, they
submitted
did.
last year from every committee.
Yes, they did.
And I think it was very helpful of them to do that, and we should take advantage of them.
Right,
They're telling us how to better get money.
Correct. And just comment on the north side, I mentioned that at the state level, like NISO, there's an annual commitment on the state.
right.
Fund
To fund the North, right. But the super Norths,
There you go, that's another side, yeah, but so. When it came to social work, I said, well, you're right, at the city level, there's always need for more hours for nurses. But the social worker expense line becomes something that we have no breadth of. There's no other something to supplement that, there's no state funding for that, so I'm glad that. But the NORC program as a whole, I think this, frankly, it should be, it should say, yeah, that's what our proposal says, NORC. And then in exclamation, the nurse hours and need for social workers. Mention that there, those are two.
now, are you making a distinction between just social workers, caseworkers, and clinical social workers?
No,
Or-
we're
No,
not, we're not,
okay,
and that's why,
All right,
like I said, it is. We
but that
can't
wouldn't be
make up
bad
things,
either,
but we can't.
but I know we can't do that.
Well, it's not that, I mean, at this point, we don't know what the
Mhm.
budget lines are.
Oh,
But what I want to ask you on the
Mhm.
social workers, and I'm asking you this for our explanation,
of course,
is there a pay parity issue? Is that,
yes,
okay, so what we're saying about social workers is that we need increased funding which is what we thought before you came. to
Because we
recruit
really
and
can't
retain.
hire real competent people because salaries are
So
not.
to recruit, to recruit and retain.
Good enough to the DOE can offer that, you know?
Okay, so we're good. Okay, we have all this stuff, we know what to put now. Because we want to be able to have a justification for it.
Okay,
I held it down to North Scotland before you said.
I know you did, I got you, we're repping.
Okay,
Thank
so we're
you.
going on to the next one now, right? We're in DOE.
HRA.
Oh, we finished DOE?
We finished everything, the permanent came and then went back.
Oh, thank you.
We didn't do HR here.
HRA. Oh, DOE, right?
Well, you explained them, but we did not write them.
Right. I'm gonna say, I think legal services is needs the money more. Because we don't have enough lawyers, people are on waiting lists for years to get
Mhm.
lawyers, and meanwhile, they end up on the street.
I agree.
And then we don't have to rank anything else because the school stuff is all ranked by CPC.
Okay.
Okay, so the next step is we're going to vote on this and also the district needs statement. So I emailed you the district needs statement, it has not changed since, except we added two statistics that were missing. And we added the story. And thanks to Larry and Robin and everybody on the committee for helping with the story, it makes it, a little bit more, human-like. The other story is on the second page of our, section.
Yeah, it gives it a face.
Okay, are we ready to vote? Yes. Oh, we can just vote at the end. Can we do everything at the end or for the intent, when we do the final roll call, we'll also vote on this? Okay, so this will do that, and then, because this is the only agenda item that we're voting on. Okay, so the next agenda item, we'll move on to CAB reports and CEC reports. CAB. Did anyone go to a CAB?
I did, we are in person now.
Yay.
Good.
We are
In person.
Yeah, and we are having so we are in person now, we are having at the end of this month, it is I think it's 25 or 30 years of Souvenir, they're having an event. 100 people, something like that, I should have to get it, but it's an event, I think everyone's invited, I'm not sure. We're gonna be there, they're having an event to celebrate the many years that Souvenir has been open. They're just working on getting people COVID vaccines and flu vaccines due to the fact that they're so high right now. And even some of their nurses dying, so COVID is not completely gone, there's people that are constantly still getting it. Their nursing homes are, the nursing home beds are full right now. They're trying to see if they can make more space or how to see what are the needs of the patients so that they can have more availability, and that's it for right now. CEC one, we're working on our legislative breakfast, it's gonna be November 14th. For elected officials, just to see, what's going on in the community, we, circulated a, informational, survey for parents. So that parents can give us their opinion, what's going on, what they need, the needs are in the community, or what are we providing that we're not providing that we can help with, what are the schools helping with? I know that PS20, Christopher Marte is having their park revenue. I'm not sure when, but that's approved, I know that.
That's funded by Parks.
Already, and, I know that some of the schools are having, their Halloween events and things like that, we did have an event for, migrant families with lawyers and, the city of New York was there to, represent migrant families and give them the information that they needed, we just had that last month, in September. And so right now, that's it, we're just planning and seeing what we can do for the families during these elections and how we support and things like that. That's basically it right now. We're just checking on what schools, need what and what, where we stand with the schools, with the fixing of the schools and how long it's taking. We're trying to work with that too. And the classroom mandates that's coming. Oh, and the new cell phone ban in schools that is in middle school. So there's a lot of parents that don't like it, but there's most parents that don't mind it, you know, as long as the kids. Usually the kids that are minding it more are the high schools because they go out for lunch and things like that, but the young ones, they really don't mind to have their phone taken away during school hours and they give it back to the but they still can use them in after school. Yeah, that's it.
I
Yeah,
my granddaughter's first phone in her bra, she's looking at message.
Smart, right? I'll bring an extra one, I'm like, boy. Yeah, he's like, do you have an extra phone that I can use for free? No.
Alright, oh, and also Christine and, Carrie are going to come to our meeting in November to talk about.
Oh, yeah, that's what we have
Program or something, I don't know.
In room 128 right now, we are having, the family resource center. As well, in room 128, they're fixing the room to have family resource centers. Now on Monday, there's a guy, his name is Michael, he goes and, any school, any parents that need help with transfers or, instead of going down to, 34th Street to get, Central and to get kids transferred to move kids from school, like anything that you need within the district, they're doing it there. So he's only there on Mondays right now, but I think, their goal is to move him into being there all the time. But his name is Michael, he's there Mondays all day from 9 AM to, I think, 2, I'm not sure. And he helps families with, any transfers, any, applying to schools, kids who are coming in to the district. I know that he had a few, other families found. And, he also helps with kids from District 75. So that's what we're having right now, maybe they're gonna.
Okay, so they're gonna, yeah, they're bigger talk about too, thank you. Well, okay, yes.
So, I followed up with the, Rivington Outside Behavioral Health. Yeah, which we've been promised for quite a while now, and they said they're actually working on it, we're progressing a little bit, year by year. And a lot of people are jumping ship in their jobs in the administration because they need to find new jobs. So I no longer have, my liaison from homeless services that called all the CAB meetings for the shelters. So I don't expect there's gonna be another CAB for a shelter before January.
What are you talking about, Remington House?
Ribbing, so no. One is the shelters, which I said we're probably not gonna have any cabs. And then I was talking about Mount Sinai Behavioral Health, which they told me they're actually working on the cab,
Two things.
two different things.
Any other hospitals, transportation?
Literally, we'll meet in a couple of weeks. I have something online from.
Okay. That's. North Southers, Remington, that's it. Okay,
Like I said, we lost, we no longer have a liaison, so we're not gonna have any cabs at shelters until we have a new administration and we have a new liaison.
okay, so, yeah, so next month's meeting is on November the 6th, right? That's what you said.
If that's what we said.
Okay, that's what you told Christine, so.
That is true.
And we will have that, and we will have, yeah, a resolution to vote on. And then a couple of other items.
Okay. Can I mention a little bit about what we were discussing on, to prepare for term limits?
Yes.
So I've been very worried, as I mentioned exec a lot, about the term limits and about getting everything documented. And I was wondering, this committee, because it covers so much and has so much going on, I wondered if maybe it would be good, take a little piece at each meeting and start making even like a timeline of what needs to be done in every month and how to do it, like in June, maybe to put on the timeline, prepare questions for budget agendas. There's sometimes in past years, we've done surveys to send to providers. You could put those, doesn't mean you have to do them, but to start creating, at every meeting, adding to a timeline and getting everything down on paper. And if you guys like, we could, along with, every month having CAB, we could also have, creating timeline.
Good, good suggestion.
I agree with that. I feel like it would help us all be more prepared, with respect to what it is we wanna bring to the meetings. And we would have more information, to better, help our meeting.
Okay, so it seems like, I think that's a good idea, I know other people are saying too, it's helpful for now, and then in a couple of years, some of us will no longer be on the board. So we need that.
So you mentioned something like this before, so basically, writing down the minutes, what it is that we went over, which agencies came, to speak with us and what they said. So it feels like we have been doing a great job with that, but I don't want to just like throw what you said on what exactly it is, and you think we should, start doing to be more organized. Like,
Okay, well, what I just suggested was to create a timeline. And on that timeline, for instance, very specifically, in June, prepare questions for budget consults agenda. Consider survey to nonprofits for district needs. Consider, generally this committee has had almost, I think, once a year, like a round table. Do you want to have a round table? So when would you start planning? Put on the timeline, start planning for a round table, which would be maybe 3 months before you're actually doing it. So that's it. It's like, what exactly are you?
The guide,
Pardon?
the guide.
Right. So that's specifically what it is, to start documenting what you need to do and the procedure for doing it.
If you like, I could start it, because, I've chaired this committee for quite a number of years now, and, I've done it. I don't remember it all the time. She always has to remind me. But, I've done it over many years, and I keep a lot of stuff. So I could just start the outline, start the timeline. Often it's the same year after year after year. We may not realize it, but it is. So I can do that, and then we can do that, and then we can put that on the agenda. Either for the next meeting or for this summer meeting, either one.
You can put it on for every meeting.
Okay.
You don't have to do it all at once. You can do like 1 or 2 months, so
Okay, so I'll start something, and we'll look at it for next meeting, and then we can continue to look at it.
Second.
Okay, so I volunteered to do something, you put that in the minutes, all right?
Yes. That's what I said. Oh, can I give actually, I do that up in the health clinic. I found out today, not on the cabin, but Tons's Health. Did we know that they are actually gonna tear it down and make way for affordable housing and the Tons's Health Clinic at Madison Street? How do I know this? I was told by the CEO of Tons's today. And apparently it has been in the works, because that land is actually managed by Bouvier Gardens Houses. And I did not know that. Obviously, we know about St. Augustine's Church and how they're neighbors to it, and that they have that little patch of land and shared with the Tonsons, and they're developing that. So that's a separate project. But Tonsons itself is going to burn down, and she's actively looking for a new site. And but in the good news, so that's not total gloom. She does have a very substantial budget, she says, from New York State for the purpose of buying land. And so she has the means to build a new property, right? Thank God. But now she.
Has she been anticipating this?
So when she threw it on me, I said, what? And the questions I asked was essentially, okay, so when did this happen? She said, Eric, it's just, I need it right now. I need to look now. So she didn't really answer the question for me as far as how long was this known, but it's the case. When do she needs to move out by? She won't specify that either. But I said, oh goodness. She's a new CEO, by the way. She started in January. And maybe the board had known this for some time, and so maybe they brought her into, so maybe it goes back that far, I don't know. But I found out today, that it's hot six, so that was kind of woo to me. Again, that land was building affordable housing on that, one. So. If the board,
Where's Madison Street?
Madison Street,
Right, in front of Henry Street, right next to 134.
Right.
Like 134 is here, the school, PS 134, and
And
then,
the Thompson's like across the street diagonally.
you see where Henry Street used to be?
Mhm.
I mean,
I'm
the fire
just
just,
wondering if there's gonna be a land use sanction, you know, who's gonna come to us. Well, I mean, we always support it.
So there's that.
So who owns the land now?
Bouvier Gardens, the housing property,
So that's the state entity.
that's what she said.
Was Lawrence in NYCHA?
No,
No,
Bouvier
Bouvier
Gardens.
but you gotta say,
Mitch Long.
So-
Oh,
so
okay.
that's-
So. News to me, right, but
Okay, well, we'll find out, we'll find out more.
Okay, so there's nothing else we can vote to adjourn.
And on the district board.
Oh, and vote on the district needs, so we're voting to adjourn, but voting on the district needs and the budget priorities that we just discussed.
yes, and yes.
Second. Okay.
Okay, May we?
Yes.
Mary Fenn, yes. Eric Diaz,
yes.
Sage Fields, absent. Naima Fafan,
Yes.
Ramya Rao, absent. Anna Kakar,
Yes.
Robin Oliveris. And Veronica Rivera, absent. Annette Scott, absent. Carmen Perez.
Yes, and present.
Well,
You know, he's in the county manager's office.